in the room ever heard of the suicide disease? I want everybody to stop and think for a second that you are in constant pain that ranges from anywhere from a 5 to a 10, mainly a 10 on the pain scale, 24 hours a day for months or even years at a time without cease. Try to imagine putting yourself in that position and visualize what your life would be like. That is exactly what people suffering with trigeminal neuralgia live with on a daily basis. So today I want to bring you all some awareness of what trigeminal neuralgia is. What is trigeminal neuralgia, or TN for short? Trigeminal neuralgia is a chronic pain condition that affects the trigeminal nerve, which carries sensation from your face to the brain. So basically, you have 5 nerves that spread out on each side of your face, and your pain in your face depends on which side of your brain that damaged nerve is. Doctors say that there's always an underlying cause for this disease, such things like MS or stroke or tumors, or you've been in some kind of accident and trauma to the head. And you can be diagnosed with TN by a doctor with an MRI test. In most cases, only one side of the face is affected, and people feel the pain mostly in the cheek area, the jaw, teeth, gums, lips. They also can feel it in the eyes and the forehead, but it's less often affected in those areas. So right here behind your ear is where the trigeminal nerve is located. So it would run up between your brain and then down behind your ear. And then the 5 finger muscles that cover your face is what is affected. What are the symptoms of trigeminal neuralgia? People say that pain comes out of nowhere, and that it's to be said that when you first start feeling the pain, that it feels like an abscessed tooth. So what do? You go to the dentist and they tell you you don't have anything wrong with your teeth. So then you just continue feeling this pain, for weeks, months, years. Just depends on how soon you get diagnosed. Some of the symptoms include brief periods of stabbing or shooting pain. The pain is triggered by things like brushing your teeth, washing your face, putting on makeup for women, or shaving your face for men. Eating something cold, or going from hot to cold, like inside, it's warm, you go outside, it's cold, and vice versa. When these things trigger your pain, the sharp pain could last anywhere from seconds to minutes to days, weeks. Doctors consider sudden and intense bouts of pain to be signs of classic trigeminal neuralgia. If your pain is less intense but constant, more of an aching, burning sensation, then you might have what's known as atypical trigeminal neuralgia. Some people with this condition also have anxiety because they don't know when their next bout of pain will come. Women are more likely than men to get trigeminal neuralgia, and the disease is more common in people that are 50 and above. The disorder may run in families, perhaps, because of how blood vessels are formed in the brain. It may also be linked to things like high blood pressure. Although the pain can be intense, the condition is not life-threatening, but it can also progress, which means that it just gets worse over time. The best treatment plan that doctors give patients with TN is to start off with prescribing you medicine like muscle relaxers like Flexeril, and also anticonvulsants like a medication called Tegretol. Although they will prescribe you with pain medicines, they will tell you that they're not prescribing you the pain medicines to ease it, because it doesn't actually ease it. They just give them to you basically to make you fall asleep, because when you sleep, it sleeps. You don't wake up in pain. Surgery. Over time, your medication may help you less and less, or not help you at all from the start. And that's common among people who get diagnosed with this. And if that happens, people have a few surgical options, but because this disease is rare with people under 50, the surgeries are basically for people who are over 50. So if you're young, you would have to have a more complex surgery, which would include taking off part of your skull and putting a pillow between the nerve and the blood vessel. Versus someone who's over 50, they would do what they call a Gamma knife, which is pinpointing radiation to that nerve just to kill it off. But Gamma knife is not for somebody who's younger, because that could cause paralysis to the face, so they don't do that for younger people. And it's also outpatient, and the more invasive surgery, you have to stay in the hospital for like 4 to 5 days. When reading about trigeminal neuralgia, you see that it affects females slightly more often than males, but approximately 10,000 to 15,000 new cases occur each year in the United States. The reason I wanted to inform you all of this is because I had never heard of this disease until I got diagnosed with it in October. But when my family and I started talking about it in my small town of Manchester, you wouldn't believe the people that come up to us or messaged us and said, oh, well, we know so-and-so has this. So, even though it's rare in our small town of Manchester, you wouldn't believe the number of people that has it, even a child who's 13 years old. So I felt like it was a good topic to inform people about, and I hope that today I've taught you at least a few things about trigeminal neuralgia. Thank you.